we'll reassess on January 15th. So essential procedures will continue, and people who need cancer treatment, mammograms, colonoscopies, have traumatic injuries, heart surgery, they will get the care they need. Again, many of those procedures to detect for cancer, mammograms, for example, colonoscopies, they also can be performed at other places other than hospitals. And we want to make sure that no one puts off critically important preventative procedures, as well as happened during the pandemic, the first wave around the second wave. And that ends up having long-term health consequences. And perhaps that's one of the reasons we're dealing with a lot of people in the hospital now, one of the other factors as well. So get those procedures done outside the healthcare system. But again, this shows our approach. It's making sure that we limit non-essential, non-urgent scheduled procedures at specific hospitals, but allows us to acquire, and also the executive order, the other reason why it's so important, it allows us to have more flexibility in securing more testing kits and getting them more widely disseminated. That it gives us what we had been in place in the early months of the pandemic that stopped when the executive powers were removed. And now we have those back now. So that allows our team to be scouring the nation and the world to make sure that we have an ample inventory of testing kits as well. So nursing homes. We've been concerned about nursing home patients. We pushed very hard to make sure that they had what they need in terms of tests. We asked nursing homes to make sure that they had testing kits as well as the boosters available in-house so they could be administered before Thanksgiving. Before Thanksgiving, we surveyed them and we wanted to make sure that there was an increase in people getting the booster shot available. Many were vaccinated, as you know. A lot of focus on getting nursing home patients vaccinated. The federal government was all over this last winter. That was fairly successful. We want to make sure now that we have enough booster shots available. So we talked to the nursing homes and long-term health facilities. We told them to make sure that they had as many places available, that boosters could be available. We had about 90% of them respond and said that they would make boosters available before Thanksgiving. So we're anticipating to see a healthy number of people who received their boosters. We're concerned about the well-being of these more vulnerable populations and make sure that they're safe. One area I can add more staffing is the National Guard. We have surveyed our National Guard resources. We know that there are numbers who have EMT training or healthcare backgrounds, and we can deploy them in a targeted way to the healthcare facilities, the nursing homes and long-term healthcare facilities where they're having a shortage. Because here's how it works. One of the reasons we have additional individuals still in hospitals who are non-COVID, who are ready to be discharged, is that the nursing homes don't have enough staff to take them. I'm on one call with an institution in Buffalo, and they said I could release 50 people right now, and that would take a lot of pressure off of them. But they don't have a nursing home to let them go to. So my question is, okay, how do we get more help on the back end? National Guard can step in. Some of the other programs we have, we're talking about the student nurse program, what they're able to do, how we get more nurses hired across the staffing services. So we have a whole broad-based approach to this, but working to increase the National Guard presence and also long-term. I said I want an order out there that I want to make sure our National Guard members start getting training to be EMTs, because we never know where we're going to need them. This won't start tomorrow. We'll start in January. It's a longer-term solution, but it's also going to be very helpful if they have to respond to a natural disaster or some other hurricane or storm, that they have this training. So we also believe that we can enhance the training capacity of our National Guard as well. And also, we've asked our downstate partners where there is plenty of capacity. You saw that, the hospitals that have plenty of capacity downstate, some of them have agreed to help shift some personnel temporarily to our hotspot areas. So those are all the strategies we're dealing right now to deal with the nursing homes and the hospital shortages that we have upstate. All right, the booster update. Again, I keep talking about boosters. There's no reason not to get the booster as long as you're eligible. We have 2.4 million New Yorkers already vaccinated with the booster. That's great. We're also going to be layering in the flu shot as well at our sites, making sure that it's available when you go to a mass vac site, you go to one of the facilities, that you can also get the flu shot. Let's make it easier on everybody. Let's be ready for both. So I mentioned the long care facilities. I think I already addressed that. Oh, here's the numbers on how many people had been vaccinated as of getting the boosters. These are already people who had the vaccination, This is the increase in people getting the boosters, the additional doses. As I was mentioning, we wanted to increase that. That'll go up higher in the next couple of weeks. We're very aggressive, making sure that every nursing home, is part of my executive order, now requires every nursing home to make sure that they have the booster shots available and that they promote them inside the nursing homes. There's a few reasons why it's complicated getting consent from people as well, but we're very focused on protecting that vulnerable population. So we expect the booster rate to continue to climb steadily after the holiday here. So we're going to have booster shots available. We're going to have nursing homes, and everybody, I mentioned that already, ramping up our vaccine and testing. Okay, we have our mass vac sites. We have a new one opening up in Queensbury shortly. We're taking appointments. Queensbury is a little bit in the North Country. We have been on calls with our county leaders. We say to them, if you want a mass vac site, we'll do it. If you're already focused on this, but you need more supplies, we'll do it. Tell us what you need. We are there to help. And so these conversations are ongoing. We'll be ramping up vaccines and testing throughout the state of New York. And so we want to make sure people get their appointments. Go to this website, ny.gov/vaccine, or call in if you want to make a phone call. But these work so well. And we're very excited partnering with local individuals across the state, whether it's the religious institutions, the churches and synagogues that were partnered with us before. Pop-up sites work successfully as well. So we have a lot to do on this. Also, I'll be announcing more about, I'll be probably gathering with do a press event on Thursday. I'm looking forward to introducing the new leader of our Department of Health, Dr. Mary Bassett. She'll be joining us. Also, we're talking about what we're doing would help children in schools. My goal is to keep kids in schools, keep them there safely, though, and making sure that we have the opportunity to have people test and return to classrooms easier than is occurring right now. And the state of New York is going to be very engaged with our school districts to make sure that they have all the resources they need, so this can be a viable option and not an expensive one for parents either, and pick up the cost. So those are some of the things we're working on. We'll have more to report on that very shortly. So we're going to continue focusing on our approach to this new variant. It does not have to be a broad brush, one-size-fits-all approach. We are targeted, but always have the tools to be able to deploy more widely if necessary. I know this is how we're going to come out of this, with a stronger economic recovery, not to have shutdowns where shutdowns are not necessary, not to have unnecessary requirements where they're not needed, but making sure that any area that is showing vulnerabilities and we see a trajectory that is not good, that we're deploying the resources intensely in a strategic way to make sure that we're doing everything that we have at our disposal and making sure that we leave no stone unturned in terms of protecting the health of New Yorkers. Thank you very much. And I think we'll take a few questions from